What is the purpose of a consultation?
The initial consultation is the most important part of the overall planning. It's the time that I get to know you. It's the time for me to understand what your aspirations are, what your goals are as far as the end result is concerned. It's a time for me to also understand if you've got any concerns about your treatment, any phobias that you need to share with me, which is so common. It's also a good time for you to get to know me and to see how you feel about embarking on any treatment with me. Not every dentist is suitable for every patient. It's important that personalities match. It's important that philosophies match. So that's a very important phase of the overall planning. Now, the second step, once I understand what your desires are, is for me to make the initial assessment. There are so many factors that I look at. There are so many measurements that I look at. I won't bother you with all of those, but I look at what's happening with your mouth. I look at your teeth. I look at the health of your teeth. I look at the positions. I look at if there are any problems happening with grinding at night. Do you have cracks? I look at your gums. If you're going to have implant treatment, it's so important to have healthy gums. What is involved in an aesthetic case, for instance? What's involved in replacing front teeth and making them look good? So lots and lots of parameters. I might not be talking to you about it, but these are all the things that I measure in an initial consultation. Now, after I get an idea as to what you want and what I'm seeing, I match the two together and we can discuss a couple of possible directions for you. Sometimes it's very simple, it's black and white, and I'll make a definite recommendation to you. And sometimes there are several options that we need to discuss. Once we've discussed, I get a bit of a sense as to in which direction you would like to head, and then I'll make a further recommendation to you as far as what x-rays we might need, and even if I need to refer you for a scan. Then I'm all yours to answer any questions you might have.
Can I receive treatment on the same day of my consultation appointment?
Sometimes, yes, it depends on what sort of treatment. If it's something very simple that doesn't require a lot of planning, by all means. And if I have the time to do it well for you on the day, then yes. If it's a scale and clean and you've got the time, by all means, why not? If it's a simple filling, any other simple treatment that I've got the time for, no problems at all. I don't want to rush you. If we spend 45 minutes talking about what we need to do, I might not have the time to do any treatment on the day. So I might recommend that we make another time, so I've got plenty of time to do a good job for you. However, if it's more complex treatment, such as implant, I need to have a look at your x-rays, I need to have a look at your scans. I spend half an hour to 2 hours treatment planning for each person, and that's done in my own time. So if I don't have the time to do that on the day at the time of your initial consultation, then I will require to plan and for you to come back to actually perform the treatment. If it's veneers, for instance, what we do before we actually prepare your teeth for veneers, we do what's called a mock-up. We've got incredible digital technology where we can digitally pre-make your veneers before we even touch your teeth. And then once we prepare your teeth, we can transfer that digital mock-up to your teeth in the form of temporary veneers so that you know what your final veneers will look like. So that requires a lot of planning. It needs at least a few weeks of planning, sometimes even a couple of months, for us to go back and forth and to make sure that you are happy, that you're going to be happy with the final outcome. And that's why we can't do all the work on your first visit.
Can I skip the consultation appointment if I already have all the x-rays needed?
So as I've already mentioned, the consultation is the most important part of the overall treatment planning. X-rays are important, scans are important, but they're about this much of the overall information that I require. When we meet, we get to know each other. I take a lot of measurements in your mouth. You might not be aware of me doing it when I'm looking at your teeth. But I'm measuring a lot. I'm looking at your gums, I'm looking at your teeth, I'm looking at the way you smile. These are the things I cannot ascertain from x-rays or scans alone. So the simple answer to that is no, I need to collect all the information necessary, including the x-rays and the scans and the measurements of your mouth.
Helen, I went to another dentist. Can you give me a quote for the same treatment without me coming?
Whenever you embark on extensive dental treatment, it is a good idea to see several dentists. Get different opinions. Different dentists have different philosophies and they will make different recommendations. If you want an opinion from me, I am happy to give you some ballpark figures. I'm happy to have a look at the treatment plan. I'm happy to give you my own advice. As I said, different dentists have different philosophies, different levels of expertise and experience, and therefore they will make different recommendations to you. It can be frustrating sometimes for patients when they go to 5 different dentists and they get 5 different recommendations. Sometimes they get confused. So my advice is, yes, go and see a few dentists if you wish, or if you found somebody you're comfortable with, then stay with that dentist and follow their advice. So can I give you a quote on somebody else's recommendation? Probably not, but I can give you an equivalent recommendation and associated fees.